1,000-pound sisters fans demand Tammy Slaton do physical therapy. The reality television world has been captivated by the ongoing journey of Tammy Slaton, one half of the famous 1,000-pound sisters duo, whose life and struggles have been chronicled in front of millions of viewers. The show, which centers on the Slaton sisters' efforts to navigate weight loss, health challenges, and family dynamics, has drawn significant attention not only for its shocking numbers but for the very human story behind the statistics. Tammy Slaton, in particular, has faced some of the most harrowing moments, often eliciting strong emotional reactions from fans who see themselves in her struggles or fear for her well-being. In recent months, a growing segment of the audience has been vocally demanding that Tammy commit to a rigorous physical therapy regimen, emphasizing the urgent need for professional intervention to support her mobility and overall health. Physical therapy, in this context, is not just a supplementary measure. For someone of Tammy's size and weight, it can be a crucial lifeline that addresses joint pain, cardiovascular strain, and muscular weakness. Observers of the show have noted that Tammy's daily challenges extend far beyond what is portrayed on screen. From difficulties in performing basic tasks such as walking and bending to experiencing episodes of shortness of breath and chronic fatigue, the need for structured physical therapy has become increasingly apparent. Social media platforms, including Instagram, Twitter, and fan forums dedicated to 1,000-pound sisters, have become hotbeds for discussion and debate. Fans frequently express their concern using hashtags, commentary, and posts urging Tammy to seek professional help. The sentiment is consistent. Many viewers fear that without a dedicated physical therapy plan, Tammy's health could deteriorate further, leading to potentially life-threatening complications. This fan-driven advocacy is fueled in part by the transparency the show offers regarding the Slaton sisters' medical journeys. Episodes often feature candid conversations about the challenges of losing weight, the medical procedures required, and the emotional toll of living with obesity. In these episodes, viewers witness Tammy's struggles with mobility and physical limitations firsthand, creating an empathetic response that motivates them to push for positive changes. Physical therapy for someone like Tammy is multifaceted. It involves not only strengthening muscles to better support her skeletal structure but also increasing cardiovascular endurance, improving balance, and facilitating safer movement patterns. Occupational therapy may also play a role, helping her adapt her home environment to reduce risks and increase independence. Fans often highlight that a structured, professional approach can prevent injuries that result from improper movement or overexertion. Critics of the show occasionally argue that the series focuses too heavily on sensational aspects rather than on the practical, health-focused solutions that Tammy and her sister could benefit from. These critics underscore the importance of integrating medical guidance into Tammy's daily routine, including physical therapy sessions, nutrition counseling, and mental health support. Proponents of this view note that while the show's drama is compelling, its ultimate responsibility is to showcase the real impact of obesity and the steps required to manage it safely. Social media campaigns have amplified these calls for intervention. Fan accounts frequently post side-by-side comparisons of Tammy's progress with and without physical therapy, referencing medical literature and expert advice to underline the urgency of professional support. Comments often stress that physical therapy is not merely about weight loss, it is about quality of life, mobility, and the prevention of further health complications. Meanwhile, Tammy herself has occasionally acknowledged the challenges she faces in maintaining an active lifestyle. Interviews and behind-the-scenes content reveal her struggle with motivation, pain management, and the psychological toll of her condition. Many fans interpret these admissions as a call to action for her support network, encouraging her to engage consistently with therapists and exercise professionals. Experts in the field of obesity and rehabilitation emphasize the critical nature of such interventions. For individuals at high weight levels, physical therapy can prevent joint deterioration, improve cardiovascular function, and support gradual weight reduction in a safe, structured manner. Ignoring these interventions, medical professionals warn, increases the risk of severe complications, including heart disease, diabetes, and mobility-related injuries. Observers of the Slaton sisters' journey note that Tammy's case is emblematic of a broader public health challenge. Millions of people around the world struggle with obesity-related mobility issues, and her story provides a lens through which fans can better understand the importance of early intervention and professional guidance. The show's producers, while primarily focused on entertainment, also carry a responsibility to highlight medically sound practices. Episodes that depict Tammy participating in physical therapy, or engaging in structured movement routines, could serve as a blueprint for viewers facing similar challenges. However, there is also the delicate balance of entertainment and advocacy. Reality TV thrives on conflict, personal drama, and emotional engagement. Introducing medical routines in a way that is both compelling and educational requires careful narrative structuring. Fans are acutely aware of this tension, and many express a desire for Tammy's story to shift from spectacle to solution-focused storytelling. Beyond the practical benefits of physical therapy, fans also stress the psychological importance of such interventions. Regular sessions with trained professionals can help boost confidence, instill a sense of accomplishment, and provide Tammy with the tools needed to navigate daily life more effectively. For viewers who have followed her struggles over years, seeing progress through structured therapy would be both inspiring and reassuring. The broader cultural conversation around Tammy's health also intersects with discussions of body positivity and medical responsibility. While fans support her as a person and respect her journey, there is a strong consensus that love and empathy must be paired with actionable steps toward health. Physical therapy, in this regard, is framed not as punishment or critique but as an essential tool for living a fuller, more independent life. Recent episodes have hinted at possible changes in Tammy's routine, including consultation with healthcare providers and brief movement exercises. Fans have seized on these moments, speculating about future developments and expressing hope that a more consistent therapy schedule will be implemented. This optimism is matched by a pragmatic understanding. Real transformation requires dedication, professional support, and time. In addition to fan advocacy, family members play a critical role in encouraging Tammy to engage with physical therapy. Sister Amy Slaton, who has successfully undergone weight loss surgery and lifestyle changes, often serves as both a motivator and a guide. The dynamics between the sisters provide a compelling lens through which fans can explore the complexities of familial support, accountability, and shared experiences in health journeys. Medical professionals, when consulted on the show or in related interviews, have stressed the necessity of individualized therapy plans. For someone of Tammy's size, generic exercise routines are insufficient and can even be dangerous. Physical therapists must tailor movements to her capabilities, gradually increasing intensity while monitoring for signs of strain or injury. This approach ensures that progress is sustainable and minimizes risk. The fan community has also engaged in fundraising efforts, awareness campaigns, and collaborative discussions to underscore the importance of professional intervention. These initiatives highlight the collective investment in Tammy's well-being and the broader educational potential of her journey. In forums and comment threads, fans frequently debate the types of exercises that would be most beneficial, drawing on expert opinions, personal experience, and observational insights from the show. The intensity of fan engagement speaks to the profound connection viewers feel with Tammy's story. While some critics argue that this level of scrutiny may add pressure, many supporters view it as a necessary advocacy tool that amplifies the urgency of health-focused decisions. The conversation surrounding physical therapy for Tammy Slaton is not merely about aesthetics or television drama. It is fundamentally about life and longevity. Each recommendation, each plea from fans, underscores the tangible benefits of intervention, from improved mobility to reduced risk of chronic disease. As the series continues to document the sisters' lives, the hope among viewers is that Tammy will embrace the opportunities presented by professional therapy, transforming concern into measurable progress. In conclusion, the journey of Tammy Slaton on 1,000-Pound Sisters is a complex, multifaceted narrative that intertwines personal struggle, family dynamics, and public engagement. The growing chorus of fans demanding her participation in physical therapy reflects a deep concern for her health, a recognition of the challenges she faces, and a desire to see her achieve meaningful, sustainable improvements. Physical therapy represents not just an exercise routine but a lifeline, offering the tools and support necessary for Tammy to reclaim mobility, independence, and quality of life. As audiences continue to follow her story, the hope is that awareness, advocacy, and professional guidance will converge, helping Tammy Slaton navigate her journey with the care, attention, and expertise it so clearly deserves. Fans remain vigilant, hopeful, and deeply invested in her progress, united by the belief that with structured physical therapy, Tammy can achieve milestones that were once thought unattainable, inspiring viewers everywhere who confront similar challenges, and cementing her place not only in reality television history but in the broader conversation about health, perseverance, and the human spirit. Thanks for watching this video and please subscribe our Beyond 1000 LB's YouTube channel for more update news.